Some habits are hard to break, and after living with diabetes for more than 40 years, Sandra Alvord can't quite get used to not having to test her blood sugar.
I've had a good life, but it's been challenging at the same time.
Sandra was diagnosed with type 1 diabetes when she was 6 years old. It's meant a lifetime of testing, shots, watching her diet, and worry.
Type 1 can be far more serious on a day-to-day basis because of the low blood sugars.
Sandra had the disease for so long that she no longer could sense when her blood sugar was dangerously low.
We would go shopping, and I'd just kind of crumble.
She passed out while driving. She had seizures in front of her kids. Her mood swings were hard to take. Scared and tired, Sandra decided to undergo an experimental islet cell transplant.
Pancreatic islet cells are the cells that are responsible for making the insulin, which humans need to control blood sugar levels.
Dr. Oberholzer says in diabetes, the cells simply don't work anymore. In a transplant, doctors take the islet cells from a donated pancreas and insert the cells directly into the liver, where they start producing insulin.
It's a very safe procedure, and most patients will be able to leave the hospital after an overnight stay.
The procedure isn't risk-free, and patients have to take anti-rejection medication, which can carry some tough side effects. Sandra's first 2 islet cell transplants didn't last long, so she underwent a third, and so far she's still insulin-free.
It's like a miracle. I thank God for every day that I'm not on my insulin pump. There's a freedom that I have now that I've never had before.
There is another type of transplant available for patients with type 1 diabetes. Here at the Mayo Clinic in Arizona and at other large hospitals across the country, they are doing pancreas transplants. And if it's successful, those patients live diabetes-free.
Typically, it is a procedure or a treatment that is offered to patients who have severe type 1 diabetes, who is disabling.
Dr. Mazur says the pancreas transplant is typically done in conjunction with a kidney transplant. But often there are diabetic patients so ill that a new pancreas is their only hope.
It's really a 24-hour, 7-day-a-week vigilance.
Skip Wallstead kept his diabetes vigilance up for years and was in very good control. But he, like Sandra, got to the point where he couldn't sense when his blood sugar was getting low, and the close calls were getting scary.
The paramedics said at that time I had maybe 5 minutes to live.
That episode brought Skip to Mayo and Dr. Mazur, where he underwent a technically difficult pancreas transplant. But, says Dr. Mazur, the results can be amazing.
Typically, from the time that the pancreas most of the time is implanted, people no longer need insulin most of the time.
The organs started to work perfect from day one.
Skip is insulin-free, but he hasn't given up medication. He will have to take anti-rejection medication for the rest of his life. But a few pills every day is well worth it to lift the veil of worry diabetes once created.
It has been a transformation of my life totally.
For Health Corner, I'm Elisa Adams.